Welcome everyone. My name is Gemma King and I'm a research officer at the Perth USAsia Centre. Today I'm joined by one of our Indo-Pacific Fellows for 2021, Alisha Sulisto. Alisha, we're very excited to have you join us today and also delighted to have you as an Indo-Pacific Fellow this year. So welcome. Today we're going to hear from Alisha a little bit on Indonesia's COVID status and their vaccine rollout. So Alisha is actually based in Jakarta. She's currently the Deputy Managing Director at Bauer Group Asia, where she helps companies connect the intricacies and interests between governments and businesses to aid companies in producing meaningful value for Indonesians. Alisha also has expertise in the financial services sector, ranging from banking, payments, insurance, and microlending. She also has a Bachelor of Arts from Monash University in Melbourne, and she has an MBA from Binus Business School in Jakarta. So Alisha, welcome. It's great to have you here.
Thank you, Gemma. Pleasure is all mine. It's always real nice to collaborate with the center.
Fantastic to welcome you back here. We had you join us virtually for our WA ASEAN conference late last year, so we're really glad to have you here with us today. Okay, I guess we'll start off with our first question. We know that Indonesia has been hit hardest out of the Indo-Pacific countries by COVID-19. I was just wondering if you could start off to give our viewers an idea of where Indonesia's at. If you could please give us a brief update on its status in general.
Certainly, and thanks again, Gemma, for the question. First of all, I think you're absolutely correct that it is by far the worst hit in Southeast Asia, even Asia. It's the only country actually in the continent that hasn't seen waves, but rather a continuous upward trajectory because government has essentially taken a policy decision not to implement meaningful mitigation measures to curb the outbreak. As of yesterday, we actually reached a very somber milestone of 1,250,000 positive cases, and cases continue to surge at a very alarming rate. Now, 50,000 cases used to take months to reach, but now it takes mere days. So what's more concerning, I think, for Indonesia is also the scale of testing is so abysmal that there's no real sense of the actual scope of the outbreak. Indonesia is actually now 150th in the world in terms of testing, and very sporadically tests according to WHO standards. But despite the surging cases, there doesn't seem to be a concerted effort to ramp up testing. Daily test rates show that Indonesia is actually testing half the specimens it tested 6 months ago even. And Indonesia's definition of testing is also, I believe, epidemiologically flawed because it often tests the same person repeatedly. So as a result, the total testing numbers are actually artificially inflated and doesn't represent the actual occurrence of positive cases. But the appointment of a new health minister recently is actually quite hopeful because his primary focus right now is on improving testing and tracing, starting with redefining those who are eligible to be tested. But the issues such as chronic lack of competent tracers will also pose a very real short-term risk for the minister to achieve this. Now, in the immediate future, Indonesia is actually looking to emulate India's approach to testing, in which Indonesia will be prioritizing antigen swab tests, which produce results in about 50 minutes as a first line of diagnosis for further testing. This is also to circumvent the lack of supply of testing kits. Now, another worrying indicator for Indonesia is actually the number of fatality rates it has, where the country is actually by and large has the highest in Asia. Even if the definition of COVID fatalities are very narrowly defined in Indonesia, where COVID deaths with comorbidities aren't accounted for, it still has twice the number of deaths as India. So this means that deaths of positive patients because of underlying heart conditions, for example, or diabetes, are not even considered a COVID fatality. So imagine what the death toll would be if it were. But even with limited data such as this, other indicators such as the bed occupancy rate of hospitals and excess death data in cemeteries also actually provide a chilling indication of how widespread the outbreak really is. So I think the data and numbers do speak for themselves and firmly cements Indonesia as indeed the worst hit country in Asia by the pandemic. I hope that answers your question, Gemma.
That answers it perfectly. Thank you for that update. It's a very sobering reality that Indonesians are kind of faced with. I think in Australia, we're definitely more isolated from the crisis of COVID. So thank you, Alisha, for giving us an on-the-ground update of what it's like over there. That kind of leads me into my next question that I wanted to ask about, which is the vaccine. That certainly brings a bit of light on the horizon, and listening to you describe the current situation in Indonesia is very needed. So I was wondering if you could please give us a bit of an update on how the vaccination rollout is going and what Indonesia's current approach is.
Sure. Well, absent of any meaningful mitigation measures, basically, government has gone all in on the vaccination program. It's allocated about 3.6 billion US dollars to procure the vaccine, which is actually a very respectable budget, right, for a middle income country. This, I think, also shows that Indonesia doesn't lack any fiscal capacity to actually procure enough vaccines for its citizens. Government is targeting to vaccinate about 181 million people, including those above 59 years old. And to do this, Indonesia needs about 427 million doses of vaccine. Its optimistic schedule is that all vaccination and subsequently its herd immunity will be completed by March 2022. And as of today, Indonesian government claims to have secured vaccines through advanced purchase agreement from 5 global producers. But so far, what we're seeing is the Sinovac-produced CoronaVac is the only one ready and available. And even with that extremely limited amount of first batch of 3 million doses, distribution is actually already behind schedule. So Indonesia's very short-term goal of vaccination is to vaccinate frontliners, which amount to about 1.5 million people by the end of this month. As of today, around 72% of health worker frontliners have received the first dose, and 29% have received the second. Now, with this calculation, it means that about 50,000 people are vaccinated on a daily basis. With this very simple assumption in mind, it would actually take Indonesia about 10 years to complete its vaccination program and, of course, herd immunity. Now, President Jokowi's target is to ramp up to about 900,000 people vaccinated on a daily basis without any days off, which would expedite the process to about 6 months. However, there is a bigger assumption, right, to make this model work, that the actual supply of vaccines are available and that there are enough vaccinators to administer the vaccine itself. So Indonesia's approach to vaccines has been to use it as the only solution to resolving the pandemic, and has taken serious steps, though, to ensure at least the supply will be available for all its citizens.
Yeah, thanks for that. It'll certainly be interesting to watch as Indonesia rolls out its vaccinations and watching as it overcomes those challenges that you mentioned. That leads me to the next question that I wanted to ask in regards to Sinovac. So as you mentioned, the Indonesian government has procured quite a large number of Sinovac doses. But the Indonesian government has also chosen to manufacture these onshore. Can you tell us a little bit about this and why the government has taken this approach?
Well, the Indonesia's government to vaccine procurement and the focus on Sinovac is actually quite reasonable, considering its lack of biomedical supply chains and infrastructure. So their focus, I think, has been to always seek a diverse source of vaccine supply, instead of having to fight with developed countries for the same pool of AstraZeneca and Pfizer and all that. I think this is also why they took a big bet basically on Sinovac, Sinopharm, and others. But they're actually also currently relying on impending supply from COVAX, AstraZeneca to some extent, and also other producers pending approvals from their respective FDAs. I think like other countries in the region, supply will definitely pose the biggest risk in terms of successful rollout of the vaccine distribution. And I think the reason why Indonesia went all in on vaccines is because government never felt it could craft policies that would be able to balance the needs of the poor and adequate public health measures. Unlike India or Thailand, who immediately recruited and trained massive amount of contact tracers, Indonesia government early on decided that these policy options basically would not be the right choice for them. So I think government's policy rationale continues to be driven by the justification of the enormous economic damage it would have to endure if the nation went into some sort of lockdown, whilst ignoring basically skyrocketing case numbers. This is also reflected in the government continuously prioritizing supplying additional hospital beds, medical equipment, without looking to turn off the tap of skyrocketing cases, right? So government's approach, I think, is very much trying to fix leaks, and the lack of qualified healthcare workers to actually serve patients, despite adding more beds, hasn't been addressed either. Indonesia already had a severe shortage of doctors with a very low doctor to patient ratio, even before the pandemic. And so the healthcare crisis has certainly exacerbated this. I think even public messaging between Indonesian leaders and others in the region also contrasts sharply. The closest in Philippines in Southeast Asia, and even Duterte expressed deep dismay, right, when cases reached 100,000 in the Philippines, saying, "We failed miserably, nobody anticipated this." And in contrast, President Jokowi said, "We should be grateful we don't need lockdowns," even when cases reached a somber milestone of 1 million. So I think government's emphasis on vaccination as central to resolving the pandemic, as opposed to coupling vaccination with strict public health measures, is unlike any country in the region. So I think that's also a central difference to its neighbors, in addition to focusing obviously on Sinovac.
Absolutely, yeah. It puts it into perspective when you compare Indonesia's approach to the regional neighbours. So thank you for taking that approach. It's definitely very informative. We'll move on to our next question now. Regarding the status of the rollout in general. So we saw Jokowi got vaccinated early this year. Can you tell us a little bit about how the vaccination rollout is going and the general uptake of the vaccine?
Right. So as I mentioned, there have been massive delays actually, right, in the initial rollout meant for prioritized groups such as healthcare frontliners. I think public reaction has actually been mixed, but most are considering the vaccine as the solution to ending the pandemic, basically the public taking their cue from government, right? And continuing to forego any meaningful public health measures such as testing, tracing, putting on masks, keeping their distance, and so on. Now, because of Indonesia's vast area to cover, in terms of the rollout, distribution of vaccines at the provincial level will be extremely challenging. While population centers in the Java and Bali Islands can be well served, I think there are a limited number of vaccinators in the peripheral islands. Issues such as shortages of basic cold chain facilities, for example, will also be a huge issue. I heard that out of the 34 provinces, 26 have already requested additional cold chain facilities. And we're talking about simple refrigerators, right? It's not the sophisticated cold chain facilities required to store like the Pfizer vaccine, for example. But a lot of provincial level healthcare facilities that are often taken for granted don't possess even a simple refrigerator. I think the other aspect that's also a bit of a hindrance to vaccine distribution is the debacle on the role of private sector in the rollout. Given how slow and, to be frank, inadequate government distribution has been, there's been a massive push actually from private sector to play a significant role in the rollout of vaccines to their employees specifically. I think this is primarily seen from companies who have labor intensive, who are in the labor intensive industry, factories and manufacturing and all that. Obviously, they want to be able to add that extra layer of protection for their workers, especially as they're considered essential businesses during the pandemic. Now, although the president has recently signed a regulation which allows private sector to procure vaccines directly from producers, there continues to be debate about vaccine inequity. And I think this is something that we're seeing around the world, right? But in Indonesia, the inequity is actually, between citizens themselves, especially when private sector becomes involved, because a lot of Indonesians who are in the formal sector are obviously middle class. And so there's a huge concern that if private sector does become involved and vaccinate their employees first, it'll basically widen the socioeconomic gap, especially as the pandemic continues to ravage basically the livelihood of the poor. So in terms of rollout and distribution, there definitely continues to be major challenges that government needs to overcome.
Right, yes. And you mentioned some of the challenges that Indonesia is overcoming right now in terms of logistics and inequity. I was just wondering if you had any thoughts on maybe the challenges that Indonesia might be facing going forward.
Yes, definitely. So, logistics distribution, I think those are basically, it's two major factors, right? But the way I see it, I think there are 5 factors that would pose significant challenges to Indonesia's vaccination program. But the biggest one, and I'm sure Indonesia will not be the only one experiencing this, is supply. Obviously, this is a problem faced by almost every country in the world. But when Indonesia, for example, sees the UK and EU fighting over the AstraZeneca supply of vaccines, the government has to wonder whether or not it would affect its own impending supply, right? So supply, the realization of all these advanced purchase agreements, I think will be the biggest challenge for Indonesia. Now, second, I think, is the speed or the rate of vaccination to actually achieve herd immunity. As I said, even in the early stages, we're already seeing delays, and this will only be compounded basically by the next 2 factors, which are logistics and distribution, as well as competent vaccinators. Cold chain distribution in particular, I think, will be a massive challenge, as most vaccines need to be stored at cold temperatures, right? Not to mention the vaccines that need special cold storage, such as Pfizer. And like I said, most first level healthcare facilities that are required and are very crucial to reach remote areas don't possess even simple refrigerators. And these will actually be the frontline healthcare providers who will be able to vaccinate in the outer islands, right? In the eastern part of Indonesia, all the way to Papua. So that will be also a major issue. And the third one was the lack of vaccinators, as I mentioned. It will pose a significant challenge, given that Indonesia's always had an extreme deficiency of healthcare workers to begin with. And it's also because professions such as pharmacists are not trained to actually administer vaccines, unlike in Australia, right, where you can actually get vaccinated in any pharmacy. Coupled, with the high fatality rate of healthcare workers throughout the pandemic, and an existing low ratio of doctors to citizens, I think this will actually be a recipe for disaster once the vaccines start to roll out. Now, I think the last major challenge would be misinformation for Indonesia. Just as with any country who's had to deal with the polarizing nature of social media, misinformation has actually also affected previous vaccination campaigns in Indonesia. In 2018, for example, government rolled out a measles rubella vaccine campaign, expecting to vaccinate about 95% of Indonesian children at the time. After I think a campaign of almost a year, it was only able to reach 68% of the 95% goal, which is actually quite concerning. And also, despite this particular campaign being years in the making through socialization, through approach to grassroots communities and all that, it still only reached 68%. Most actually refused based on religious beliefs. And I think this is actually also a learning experience for government because ahead of the rollout of the COVID vaccines, it has actually started to embrace and work together closely with major Muslim organizations to ensure the halalness, basically, of the COVID vaccines to the public, trying to counteract what happened during the MR vaccine campaign. Now, I think the last challenge, but could be sort of a wild card factor, is vaccine nationalism that might result in potential geopolitical tensions. So, for example, what if Indonesia decides to demand purchase of vaccine surpluses from Australia, right? Because Australia has obviously secured 4 to 5 times its population size of vaccine doses, right? And what if Australia then refuses to do so? Are the producers of the vaccine actually limits Indonesia's ability to do so? Will it contribute to bilateral tensions between Indonesia and Australia? But I think that is something that might not materialize in the short term as Indonesia seeks to secure its own short-term supply. But it's definitely something that needs to be looked out for in the midterm, I think.
Yes, it's certainly a very complex and multifaceted issue that will definitely be one to watch over the years. Indonesia continues to roll out its vaccine. Australia is just starting to roll out the vaccine here, so it'll definitely be a big year of news to watch as people start getting vaccinated, and we're excited to have you with us throughout the year, and you can provide us some more analysis on Indonesia's vaccine status as well as other issues that our audience will be deeply engaged in, I'm sure. Alisha, I just wanted to turn over to you. You've done a great job at covering everything so far, what is a really complex issue. Do you have any final thoughts?
Thanks, Gemma. And indeed, this is an extremely complex issue, right? And it's I think there are a lot of overlapping challenges that will be experienced not only by Indonesia, but a lot of neighboring countries. But I just wanted to say that all in all, the reason why I believe Indonesia is faring so bad compared to its regional peers in terms of the pandemic management is precisely because of its policy decision to prioritize economic recovery at all costs, to the detriment of human lives. What's very different about Indonesia compared to, for example, India, Malaysia, Thailand, or Philippines is I think there's no explicit attempt to implement circuit breakers, reduce mobility, or curb commercial activity, which obviously naturally encourages the virus to spread, right? And because of the lack of mitigation measures, it's focusing solely on the vaccination program. But I also want to say that Indonesia is actually doing a slightly better job in locking in supply than most countries, such as South Africa, for example. And obviously, it's better than nothing, right? And Indonesia's vaccination procurement process, I believe, is actually a bit more advanced. But as I mentioned, unless it overcomes the major challenges, I mentioned just now, it would be extremely difficult to expect a completion of March 2022 for its vaccination program. So I think that sort of concludes my remarks, Gemma. Thank you very much.
Thank you, Alisha. Yes, it's a very, very interesting topic, and I'm looking forward to hearing more from you on it throughout the year. And yes, again, Indonesia is definitely the country to watch as it rolls out its vaccine. Well, once again, thanks, Alisha, for joining us today. We'll be watching you throughout the year to see the content that you put out with us as an Indo-Pacific Fellow, and we encourage our audience to stay engaged. We've got a fantastic lineup of fellows this year who will be delivering some really dynamic and interesting analysis from the region. So thank you, Alisha, and thank you for watching.